It is now super fast and easy to find the best healthcare.gov plan for your clients. You'll be saving them a ton of money, and you can do it all in less than 5 minutes with the Lumos broker tool. This is a game changer. It allows you to put in your expected usage for the year and finds you plans with the lowest total cost of care. Here's how it works. We start by providing applicant information, getting a subsidy amount, and specifying any drugs and providers. This should be similar to the tools you've used before. But here's how Lumos is different. We let you add usage details for your clients based on how they expect to use their insurance. One way to do this is by using one of the prepared scenarios we have here and just tweaking the details from there. The best way though is building a scenario specific to your customer. For example, here I have a scenario inspired by an actual customer I had. She expects to have similar usage this coming year, so we just downloaded her claims from last year and dropped them in here. Providing this info allows Lumos to do a personalized calculation for the cost of each plan, inclusive of both premiums and the cost of these services. We like to call this figure the total cost. Now let's click Get Results and let Lumos do the work. And boom, the results are back, and right away we see a list of plans sorted by lowest total cost. Most other tools will just show you the premium and leave you to figure out if it's a good deal based on a laundry list of copays and coinsurances. But we boil all that information down into one single number, the total cost. The total cost is the premium plus the cost for all the services you listed earlier according to how it's covered by each plan. So let's pick a plan that covers our hospital and see how Lumos works out the total cost for a particular plan. First up is a quick summary of the total cost. The premium after subsidy plus $250 per month in usage cost results in a total cost of just a bit over $1,000 per month. We can also see that usage cost broken down across the two family members, with most of the costs coming from the spouse. And in this final section, we see how each claim is covered by the plan. For a simple PCP visit, Lumos has read the plan details and reports that it's just a $90 copay, and an urgent care visit is $155. Let's click in for more details on this MRI claim. It's covered as coinsurance, and since the deductible hasn't been met yet, the consumer is responsible for the full amount. Lumos keeps track of the deductible though, so by the time we get to the claim for this procedure, it recognizes that coinsurance kicks in. After paying the last $50 towards the deductible, the remaining $2,000 for the claim is covered at 50%. With confidence in the total cost calculation, you can then narrow down your choices and compare plans. Let's say our customer really likes Cigna and is interested in one of their gold plans. Let's compare it to the Florida Blue plan we were just looking at. This level of detail will allow you to have a transparent conversation with your customer on which plan is the best deal and why. The first chart shows the total cost breakdown. The Cigna plan on the left has a higher premium but a lower usage cost. The net of this is that the total cost is higher than the Florida Blue plan by about $300 per month. As before, we can also see the usage cost breakdown, and in this case it is cheaper for both customers to be on the Cigna plan in terms of usage cost. To finish unraveling exactly why the usage cost is less, we can look at the individual claims. The PCP cost is lower, as is the urgent care, $30 versus $155, as is the specialist, $80 versus $155. Much of the difference comes from these MRI and procedure transactions. When we click into it, we find that not only is the deductible much lower at $500 versus $1,650, but the coinsurance percentage is also much lower, 20% versus 50%. So if we were to add more claims, this Cigna plan would look better in terms of true cost relative to the Florida Blue plan. But given the particular scenario that we've put in, the higher premium of this Cigna plan is just not worth it. As you explore more plans on this platform, you'll quickly find that the difference in total cost between plans can often hit somewhere around $200 per month. That's thousands of dollars each year. When you're delivering that kind of value, you can be sure that your customer will re-enroll with you next year and be referring their friends back to you.